Cardiovascular disease, CVD, is a broad term used to describe disorders that affect the heart and blood vessels. It includes conditions such as coronary artery disease, heart attack, stroke, heart failure, and peripheral artery disease. According to the World Health Organization, CVD is the leading cause of death worldwide, responsible for approximately 17.9 million deaths each year. Despite being life-threatening, most cardiovascular diseases are preventable through lifestyle modification, early diagnosis, and proper medical management. Types of cardiovascular disease. 1. Coronary artery disease, CAD. Caused by the buildup of plaque, atherosclerosis, in the arteries supplying the heart, leading to reduced blood flow and risk of heart attack. 2. Cerebrovascular disease. Includes stroke and transient ischemic attacks, mini-strokes, caused by disrupted blood flow to the brain. 3. Heart failure. The heart becomes too weak or stiff to pump blood effectively. 4. Peripheral artery disease, PAD. Narrowing of blood vessels in the limbs, usually due to atherosclerosis. 5. Rheumatic heart disease. Damage to heart valves caused by rheumatic fever, often following untreated streptococcal throat infection. Causes and risk factors. CVD develops due to a combination of genetic, lifestyle, and environmental factors. Non-modifiable risk factors. Age, risk increases with age. Gender, men are at higher risk, but women's risk increases after menopause. Family history, genetic predisposition can play a role. Modifiable risk factors. High blood pressure, hypertension, damages artery walls over time. High cholesterol, leads to plaque buildup. Smoking, narrows arteries and reduces oxygen in blood. Diabetes, damages blood vessels and increases plaque risk. Obesity and physical inactivity, increase strain on the heart. Unhealthy diet, high in saturated fats, salt, and sugar. Excessive alcohol consumption, raises blood pressure and weakens heart muscle. Chronic stress, contributes to unhealthy habits and hormonal changes. Signs and symptoms. Symptoms vary depending on the type of CVD but may include chest pain or discomfort, angina. Shortness of breath. Fatigue. Irregular heartbeat, arrhythmia. Swelling in legs, ankles, or abdomen. Sudden weakness or numbness, stroke warning sign. Diagnosis. Doctors use several tools to diagnose CVD. Electrocardiogram, ECG, detects heart rhythm problems. Echocardiogram, ultrasound imaging of the heart. Blood tests, measure cholesterol, triglycerides, and cardiac enzymes. Stress test, monitors heart function during exercise. Angiography, X-ray of blood vessels using dye to detect blockages. Treatment. Treatment depends on the condition and severity, but it often involves 1. Lifestyle changes. Heart-healthy diet, rich in fruits, vegetables, whole grains, lean proteins. Regular exercise, at least 150 minutes/week. Quitting smoking and limiting alcohol. 2. Medications. Antihypertensives, for high blood pressure. Statins, to lower cholesterol. Antiplatelets or anticoagulants, to prevent blood clots. Beta blockers, to lower heart rate and blood pressure. 3. Surgical procedures. Angioplasty and stent placement, opens blocked arteries. Bypass surgery, creates a new route for blood flow. Heart valve repair/replacement. Pacemaker or defibrillator implantation. Prevention. Preventing CVD is more effective than treating it. Key preventive strategies include maintaining a healthy weight. Eating a balanced diet low in saturated fats, trans fats, and salt. Exercising regularly. Avoiding tobacco products. Managing stress. Controlling blood pressure, cholesterol, and blood sugar levels. Getting regular medical checkups. Global impact. CVD is not only a health problem but also an economic burden. It affects productivity, increases healthcare costs, and impacts families emotionally and financially. In developing countries, the burden is higher due to limited access to healthcare and preventive programs. Conclusion. Cardiovascular disease is a major global health challenge, but it is largely preventable. Through early detection, healthy lifestyle choices, and adherence to treatment, millions of deaths can be avoided each year. Public awareness campaigns, community health programs, and government policies promoting healthier living are essential in combating this silent killer.